The global public health community has a host of interventions to control under 5 mortality. And these are affordable, and they're effective, and they're simple. However, over 2 million kids are still dying of pneumonia, diarrhea, malaria. So the challenge is, how do we deliver these interventions to the families at risk? The good news is that there's a strategy that seems to be doing that, and there's evidence that it's working, and it's called Integrated Community Case Management. iCCM is a strategy to equip, to train, to support, to supervise community health workers to deliver these life-saving curative interventions for pneumonia, malaria, and diarrhea to children in communities who otherwise lack access to case management from health facilities. In the past decade, many sub-Saharan African countries have introduced and even scaled up the iCCM strategy. Now it's even including malnutrition and sometimes newborn infection.
Ça aide très bien les gens, parce que ici, quand elles viennent, il y a des produits qu'on donne gratuitement. On donne des conseils qu'il faut faire. Donc c'est moins cher qu'aller à CESCOM, et c'est plus proche aussi.
Masassaran gada da ke yi likita gada kama mun ji daɗi muna murna. Da yaran mu sun kamu da masassara maza man kai su awo man magani sun samu lahiya.
Ana hule community na ulundo na di ku karanga na ku karalo ulundo na wana kitana ga mini na kwenga katai. Yani kuna nyari ngakuna kumore ba diri na modu nyana ya lango ya correct sandu kukin asat na de na medamu na lo treating utulu ibang nyena na nyola do ku program na ganade.
The correct treatment of diarrhea, pneumonia, and malaria is one of the most powerful interventions we have to reduce child mortality. In order to best implement iCCM, 1, government leadership is essential. Secondly, with government leadership comes coordination and harmonization of efforts. Thirdly, training of community health workers using standard protocols, standard manuals. Fourthly, we need standard protocols for supervision, a supervision that sort of aims towards skills reinforcement and problem solving. Lastly, it's ensuring that commodities are available at all times. Without an uninterrupted supply of medicines, iCCM cannot succeed.
Children from remote communities often just don't have access to these treatments, and iCCM is a strategy to redress that imbalance. And there's accruing evidence that, in fact, this is happening in sub-Saharan Africa.
It is an essential strategy that can foster equity, but can also contribute to sustained reduction in child mortality.
As iCCM programs have been scaled up, there's been a large amount of information collected on the strength and limitations of these programs. This iCCM Symposium will bring together donors, researchers, Ministry of Health, and other organizations that are implementing iCCM in order to identify best practices, gaps, and priorities to improve the scale-up of iCCM programs.
We see this as a call to action. It's all about making a real difference on the ground for children, particularly those children that are living in hard-to-reach and underserved communities. Following the Global Symposium, UNICEF and WHO, in collaboration with other partners, will work to support national governments to incorporate new learning, the best practice, and the innovation. These are especially needed in order to strengthen iCCM and community health worker programs so that together we're able to deliver more life-saving treatments to children.
We are taking this opportunity to have this symposium now because iCCM is gaining great momentum throughout Africa. It's an incredible opportunity.